All right, Callie, thank you. Tonight, some hospitals in West Michigan are at or nearing capacity. The recent surge in COVID-19 infections is filling up beds and forcing doctors and hospital administrators to send their patients out to other facilities. Our Sam Neff joining us now live in Battle Creek to explain what else hospitals are doing to make room. Sam.
Well, all of the health officials I spoke to today say capacity is always a concern this time of year with the flu and other seasonal illnesses, but you add in the surging numbers in a global pandemic, and many of these hospitals are finding themselves in stressful situations. They say it's up to the public to be responsible to help. Oaklawn Hospital is now at or near capacity of COVID-19 patients. Chief Nursing Officer Teresa Dawson says Oaklawn has the rooms for more COVID-19 patients, but not necessarily the staff. During the first wave of COVID-19, Oaklawn, like many hospitals, halted elective procedures. It freed up staff to treat COVID patients. Now the hospital is doing both.
I do personally worry about it. I was just talking to a colleague of mine, and it's something that you lose sleep over.
In the last week and a half, Oaklawn has had to send a few COVID patients to other hospitals. Bronson Battle Creek has also had to divert patients. In the spring, the most COVID patients Spectrum Health West Michigan had in all of its hospitals at a time was 85.
As of a few minutes ago, we're at 156, so nearly double. And what gives us the most concern is that we are doing a very large amount of testing, and our percent positives continue to go up. And I think we're really at the base of what could be the mountain of a second surge.
ProMedica Coldwater Regional Hospital is not at the point of diverting patients. Dr. Brian Kaminski says the hospital is monitoring the upward trend of cases, especially during flu season.
The trend in COVID cases that will require hospitalization might get us into a really stressful situation.
All of these health officials say treatment and preparation are better now from the experience of the last 8.5 months. They say people resisting the urge to ignore COVID-19 guidelines could be the difference in preventing hospitals from getting overwhelmed. And hospitals have discussed ways of dealing with these capacity issues, and those involve setting up mobile hospitals like we've seen closer to Detroit, and also converting space within hospitals to treat more COVID-19 patients. Live in Battle Creek, Sam Neff, News Channel 3.